each of these inhibitors has a slight distinction with ruxolitinib, although overall as a class, these drugs seem to provide at least some degree of symptom benefit and spleen improvement. And the really distinctive factors that we've seen so far in the clinical trials would be highlighted by, in the case of momelotinib, that some patients have improvement of anemia, which is very different from ruxolitinib, in which case anemia improvement is basically never seen. In fact, some patients with ruxolitinib, the anemia will in fact get worse. In the case of pacritinib, there's very little effect on the platelet count, to the point where this drug appears to be safe, at least in terms of the platelet count, to be administered in patients even with platelet count below 50. In the case of ruxolitinib, that is definitely not the case. It does lower the platelet count, and current recommendations are to avoid using it with the platelet count below 50. And fedratinib is distinct to some extent from ruxolitinib in that it is more selective for JAK2 and not both JAK1 and JAK2 like ruxolitinib. It also does hit FLT3, which is a target that is not affected by ruxolitinib, although whether that has any particular relevance in the case of myelofibrosis is not clear.